continue to improve significantly. If we look at PCR testing overall system-wide, we've done 917,700 tests, and we've tested 504,354 people with a total positivity rate of 17.3% throughout. At Baptist Memphis alone, we've tested 74,063 people with a positivity rate that's lower, 10.6%, as we've seen in some of the urban areas. Have been a bit lower here. If we look at hospitalizations, they continue to improve nicely. We sort of stair step down, and they'll typically stay in one little level for several days and then dip down again. Acute care patients out of the ICU at Baptist Memphis with COVID, we have 7 people, and we have 10 people left in the ICU with COVID-19. 8 of those 10 people are on ventilators. There have been 1 person admitted to Baptist Memphis in the last 24 hours, and none was fully vaccinated. 3 of those 17 people in the hospital right now total are fully vaccinated. And if we look at Baptist DeSoto, there are 14 people on the acute care floor beds with COVID-19 and 5 in the ICU. 4 of those 5 in the ICU are on ventilators. They have had 2 admissions over the last 24 hours with COVID. None of them have been fully vaccinated, and only 1 in their group of 19 was fully vaccinated. So we have 17 and 19, which continues, thankfully, to go down very nicely. I would just remind you that at this institution, the lowest we got between the Alpha and the Delta wave was at 10. So we're headed down that direction. Thankfully, the difference is that we had Delta a bit more on the horizon at that point, going through India and some degree in Europe before it got here. So we don't have anything quite like that. We have areas that are increasing, some in Europe and others, but nothing like what we had really on the horizon when Delta was there before. So we're hoping, at least for the coming weeks to months, that we won't see anything of that type that's a potential threat in the near future. So happy to answer any questions if I can.
Hey, Dr. Threlkeld, it's Corinne. How are you?
Good, Corinne. How are you?
Doing all right. So I was wondering if you could talk a little bit about the new study looking into how long natural immunity really lasts and kind of the new information we're getting on that front.
Yeah, so it's interesting. There are actually 2 or 3 studies that have come out. If you look at natural immunity, or I should say, an immunity to natural infection versus the immunity that you get to vaccinations, and so you can see that. I think one of the real tenets that we've seen of late is that immunity tends to wane in both instances, and yet we think that from one of the new studies by the CDC that, and that's a compilation of multiple studies that they did. The suggestion was that the immunity was more consistent. More people got good immunity in the vaccinated group than they did in people who had natural infection. In both instances, however, people seem to have at least 6 months of pretty good protection themselves against COVID, and more specifically severe COVID. And then there are other studies that have come out. There was a more recent one that showed neutralizing antibodies, and this was done where they took samples of people who had natural infection, and they found that those samples had neutralizing antibodies in them that would still inhibit COVID-19, both pseudoviruses and actual virus, for up to at least 10 months or so. Now, the problem is that, like all of these studies, there is a fair amount of individual variation. And as I say, if you look at that study that we talked about a couple of weeks ago, antibody levels do wane. And one that came out of, I forget the source of this one, I think it actually was Yale School of Public Health, did some modeling and showed that antibodies do wane, the neutralizing antibodies particularly wane fairly quickly. And by 16 or 17 months, you're down below 50% protection. And you might see the sort of thing that we see in the common cold coronaviruses, the so-called endemic coronaviruses that are circulating at any given time in our population already and cause the common cold. So some studies have showed that the decay of these antibodies would be on par with those viruses. And then this more recent one suggests that maybe they don't decay quite as fast. And so we may have good protection going out to 10 months. But what is not really disputed is the fact that vaccinations give you more complete penetration of immunity. And also, if you've had the natural infection, the vaccines will give you more protection on top of it. And probably the most frustrating thing that I see is people who've had the natural infection and they think that that natural immunity is fine. And it probably is fine for a number of months. We just don't know how many. And we don't know that you're one of those people who is maximally protected. I find this particularly problematic with healthcare workers. And I've had some significant arguments with some of my colleagues in healthcare. I think the fact that you are regionally protected for some months after your natural infection is not enough, because we take care of people who are immunosuppressed. And I think that we need that extra 2 to 3-fold protection that you get on top of natural infection by the vaccine. That was shown in that Kentucky CDC-sponsored study that showed that you were 2 to 3 times more likely to avoid further infection at all, let alone the more significant or severe infections, by getting the vaccine. And when you don't get the infection at all, you cannot therefore give it to someone else. And so I think that that should make you lose sleep at night if you're a healthcare worker and you are able to protect the patients that you take care of by 2 to 3-fold, and you don't do it. So that's kind of a sort of a more passionate point for me personally when I talk to folks and colleagues in healthcare. All that said, then how many times do we boost for that phenomenon? And I think that's the more difficult one, because we do know that these antibodies wane, but likely whether it's the second vaccine or the third. Some would say that the third vaccine will last a lot longer, but obviously we don't know that yet. And so I think that we are going to have to decide at some point in the near future, what our goals are. If our goals are to prevent serious infection, then probably 2 shots are already enough. The third shot or the booster shot, I'm not counting on to protect me dramatically more against severe infection or hospitalization. Really, it's the reason I went out and got the third shot or the booster shot as quickly as I did is that my getting a less severe infection would be of more damage than some people might, because I'm around people that might not be protected at all. And so we have to get together on what our goal is. Obviously, the key goal is protecting any severe infection and death, hospitalizations and the like, to prevent the overload of the healthcare system and to prevent deaths. But again, we can't forget that segment of the population who doesn't get immune, even if we do vaccinate them. The St. Jude kid is the perfect example, but many people who are adults and elderly, we lost some people in the elderly age group who were immunosuppressed, who had been fully vaccinated and got the infection and died. So that's where the herd immunity phenomenon comes in. And once we get enough people vaccinated, then those people will be relatively protected. Unfortunately, this is a very contagious virus, at least is the Delta variant, and we have to have a vast majority of people vaccinated to make that protection. And if I maybe just sort of a side point, you look at what's going on in Colorado right now. If you look at Colorado, they're having something of an additional surge and their hospitalizations are somewhat overrun. They have a higher than national average rate of vaccinations. They're up to 62% fully vaccinated in their state. That's very good compared to other states. But the problem is there's still a lot of people in that state who are unvaccinated and unprotected. And so those people are the ones who are being hospitalized. It's not the vaccinated people, much as we see here, but they're having sort of a run of the virus through the state right now. And for at least the foreseeable future, and certainly right now, whether you're in Tennessee or Colorado or what have you, there are still plenty of people to get sick and to get hospitalized and to die. And yes, to really sometimes stress the healthcare system. And even if they don't get critically ill, they can pass it along to other people who might not be protected because of their immune system. So all of these things play in. We hope that we can get enough people fully vaccinated to where we can protect those people without continuing to have a booster shot every year. That would be the goal, is to cut down the vaccination. And again, one of the other sort of great lies about this that you'll see on social media is that the vaccine does not prevent transmission. It absolutely prevents transmission. If you look at good data, it cuts down the rate of infection by 6-fold, deaths by 11-fold. People who don't get the infection do not pass it to someone else. And so people are forgetting the fact that it does protect you from getting any infection at all by several-fold. You still can get it in a lot of people, but a lot of people are not getting it at all because of the vaccine. And if that's the case, you can't then pass it to someone else. And people forget that point. So I think that it just really points out the importance of the vaccine moving forward.
The second question I had for you, just a little more anecdotal. is about fatalities we saw in October. We've talked before about how deaths are a lagging indicator, but we did see, a relatively high number of fatalities countywide in October. Is your sense that those were people who were infected, during the peak in September and then just had a prolonged hospital stay?
Yes, it is. That's been by and large our. Now, we still have people who are immunosuppressed who come in and don't do well. Some people who are elderly who have gotten sick, a couple despite having been vaccinated. We lost 2 people to COVID in the last 48 hours. I don't know if they've made the statistics yet. They probably haven't. One young, unvaccinated, one was vaccinated, but was immunosuppressed. And so, yeah, I think that, and part of that, you can see it in a lot of different ways. If you look at the hospitalization data that I mentioned a minute ago, the vast majority of the people in the ICUs are on ventilators, and almost all of them have been on ventilators for a long time. Several at our hospital, for example, have been on ECMO support for a long time. Those are 2 very large tubes that take blood out of you and oxygenate it artificially and put it back in you. Those are prone to getting infected. They are large interventions, and we have people on them for weeks, sometimes months, with this disease. It takes a long time for the lungs to recover, and many of them are not. And that doesn't even take into account, one of my partners, Ahmad Omer, was talking to a pulmonologist today who is seeing a lot of people in his clinic who have post-COVID lung damage, and it is destroying their quality of life in a good number of them. And those are numbers that you don't see in the hospitalization and fatality rate. Those are the people who survive, but don't survive with nearly the quality of life they had before. But again, the short answer to your question is absolutely. Most of the people that we're seeing dying now have been in the hospital for a fairly long time. And you can see that because most of our hospitalized patients in the ICU are on ventilators, and a large percentage of the people in the hospitals are indeed in the ICU. So that's what we're seeing right now. We hope that, and again, that there's still a lot of people who are unprotected in our population who are potentially going to get infected and might die. But thankfully, our numbers are way down now because Delta has sort of run its course here, seemingly. And unless it's reintroduced in some way or another variant comes along, we hope that we're going to have a time as we approach the holidays where we will be spared all of these infections and hospitalizations and certainly deaths.
Talk about what parents need to know about that Pfizer vaccine for young kids.
Yeah, so it's obviously the order of the day, having just been approved. The CDC committee voted 14-0 to approve the Pfizer vaccine in the 5 to 11 age group. Rochelle Walensky, the head of the CDC, approved that, and so those recommendations are now formalized, and kids are getting vaccinated as early as today. One of my partners had a young child set up for tomorrow. Some places around the country won't get to the logistics of it until next week. But you're talking about 28 million kids. And these are kids that aren't protected right now. And so we have the capacity to protect them with this vaccine. Not to mention that that's just one more piece of the umbrella over the grandparents, too, particularly people in larger households. I don't know of any grandparent that can resist hugging their kid, a school kid, infected or not, for that matter. And so it's another important piece of protection for them. This vaccine was 91% effective at causing or at preventing symptomatic infections. We have to say both sides of the argument. I don't think the vaccine should be mandated in 5 to 11-year-olds. I struggle with any emergency use authorization item being mandated. I wasn't for any mandates of the vaccine until it became fully FDA approved. We have many mandates for vaccines already in FDA approved vaccines. So there's nothing new about that phenomenon. And this vaccine has been given to more than 1 billion people worldwide. It's been tested more extensively than anything else in history. But if you look at the under 18 age group, they are much less likely to get severely ill, obviously, than adults, a fact that is widely repeated. But that said, there are thousands upon thousands of people under 18 who've been hospitalized, about 700 dead. And so it's unclear the long-term ramifications that we've talked about, lung damage, other issues. We've seen diabetes linked. I have a young patient who presented with a severe case of diabetes, had not had diabetes before, recently been checked, but had rather severe diabetes with the onset of the severe COVID. So we really don't know a lot about the long-term ramifications. If you look at the polls with parents of young children, about a third of them have said that they're going to wait and see what happens. And I can certainly understand that. The biggest concern that people voice specifically, of course, is that of myocarditis. And there are two things about myocarditis that people need to remember, and that is that the biggest caseload of myocarditis are in males in the age 16 to 29 group, people that are already, by the way, approved for vaccinations and have been getting them. And a rare number of them get, in fact, myocarditis. That's the same age group that is most likely to get viral myocarditis, Coxsackie B virus being a common one, but many other viruses can cause viral myocarditis. That age group and male gender seems to be a risk factor, an important one, in being susceptible to myocarditis of any type. It's important to point out that unlike some of the Coxsackie B virus myocarditis, which can end up in heart transplants or significant ICU support, the cases that we see associated with vaccine tend to be very mild and to be fully recoverable. But that's one point about it. The second point is this idea that you're safer not getting the vaccine than getting the vaccine, even with respect to myocarditis. Now, never mind all the things the vaccine doesn't get you: chronic lung disease, other potential spin-off long COVID stuff, a small number of deaths, and certainly a larger number of hospitalizations. All that, you don't see it all with the vaccine. The myocarditis, even the one thing that is the point of concern for most parents, you have a several-fold higher chance of getting myocarditis from COVID than you do from the vaccine. So statistically speaking, it sort of is a no-brainer. Our brains are wired such that we don't like to take risks, and we view not vaccinating as avoiding the risk of the very, very low rate of myocarditis in kids that get vaccinated. But again, you have to remember that the rate is much higher if you get COVID-19, and that would be fine if not many kids got COVID-19. But we now know in more recent data that they are as susceptible as adults are at the most recent data we've gotten at getting it. They just don't frequently get ill from it. But they are significantly more likely to get myocarditis than are people getting the vaccine. So that's what we really have to remember. And further, the age group of 5 to 11 is below that group that is most at risk. We've already vaccinated the people, or are vaccinating the kids in the age group that are the most at risk for getting myocarditis of any type, including to the vaccine. So the 5 to 11 age group is a group that we don't expect to see it in nearly as much. And so far in the testing, we really haven't. So again, the irony is that the biggest reason that people are going to wait, the myocarditis, will cause some people to wait, and necessarily by waiting suffer a 4, 5, 6-fold bigger risk of the thing they're trying to avoid by not getting it and facing the virus itself, which is a lot more likely to cause that. So I think there's some statistical irony there that people need to make sure that they've educated themselves about that. And you know, I take care of kids too, and I've seen a bunch of kids in the ICU with COVID. Thankfully, I've not seen anyone die from it in the pediatric age group. But I'll say that, like adults, people, you know, I hear report after report about all the terrible things that are happening to people with vaccines and the deaths that are associated with vaccines. They simply aren't real. You know, I've been taking care of COVID people since the first case in Shelby County in early March of last year, and I have long since, I've said this many times, long since lost track of the number of people who have died of COVID that we have seen. I have not yet seen, nor have any of the infectious disease guys in town that I have talked to, may have changed in the last few weeks, but none of us has seen a case of a hospitalization due to the vaccine. And again, I remember the first day it came out, I've mentioned this before, but when it came out in England, there were a couple of healthcare workers that got an anaphylactoid reaction. And we said, you know what, we've talked about this for about 45 minutes now, these people reaction. They went home, they did fine. And while we've been talking about it, about 85 people have died of COVID in the United States. Now, thankfully, those numbers are down now. But again, I think the statistical reality is that your kid is safer getting the vaccine than not getting the vaccine. And if there's anything else we need to know, I would love to hear it. That, to me, is by far the most important issue. Any other questions?
I think last thing you were going to talk about the flu season. How's it going to be this year?
Yeah, it is the big question mark. You know, we don't know. I think the problem that people worry about is twofold. Number one is that mild flu seasons are frequently followed by more severe flu seasons. Maybe there's not as much immunity. The immunity changes from year to year. That's why we have to have a different vaccine, but there may be some residual immunity. So we worry certainly about this being, we've missed 2 years now, essentially, of the flu. And so it's a big wild card. I've certainly already gotten my vaccine. I got it a little bit earlier this year than I have done it in the past years, simply because we don't know what's going to happen. Now, thankfully, the Southern Hemisphere, which usually gets it first, it's their winter after all, moving into their summer now, has not had a severe problem with it so far this year. So that's a bit encouraging. But when you look at the fact that we could face a worse year after a couple of really, one year that was near zero, and a mild year before that. And then all of a sudden, we're also sort of diving back into the pool of risk for the flu. Kids are in schools without masks. There'll be more family gatherings, more social gatherings. Those are the sort of things that pass the flu much as they pass coronavirus. And so there are a couple of risks for it happening. We hope it won't, but certainly I would recommend people getting the flu shot this year if you ever have gotten one. And certainly, again, even if you hadn't, it's not the greatest vaccine at preventing mild illness. But it, like COVID vaccine, is very good at preventing severe illness, hospitalization, and death, particularly in the elderly. There's some very similar situations in those vaccines. So this year would be the year that you should get that flu vaccine, because we really don't know where we're going to go with it. Any other questions? There are a couple questions from the feed that I want to touch base on. Number one is Marguerite Winkler asked about knowing about antiviral drugs, that she had a sister-in-law who was a retired nurse, was vaccinated, but hadn't gotten a booster, got COVID while on vacation in Colorado. That's a good place to get it right now, it turns out. Was given steroids, antibiotics, and antivirals. I'm not sure which antiviral in that situation that she means, presumably maybe remdesivir. So the antivirals, just in brief, we have the true antiviral things. The two classes of therapies are the immune suppressants once we get sick, steroids, tocilizumab, baricitinib, and those sorts of things that calm down an out-of-control immune system that got angry because COVID got the better of it, for lack of a more scientific way of saying it. And then there are those treatments that you can give early on that actually affect the virus. And so remdesivir is the one that's approved for that, though it turns out that the longer you wait in infection, the less clearly effective remdesivir is. And some of the data of late have not been terribly impressive. There are some data that look really good for remdesivir as prevention, kind of like we use monoclonal antibodies. You give 3 doses intravenously before you get hospitalized. It's not yet approved for that purpose, but the study that they put out showed pretty good efficacy if given like the monoclonal antibody for early disease. That's really an antiviral activity. Same with monoclonal antibody. We talk about natural immunity. I think natural immunity is to a vaccine or to a natural infection. The immune system does it naturally. Artificial immunity is when we give monoclonal antibodies. We essentially supply an arm of the armed forces to do the job for us in the monoclonal antibodies. We pour them into you and it attacks just as if it had been our own. So monoclonal antibodies are an important way to give antiviral therapy early on. Those things are relatively inconvenient, however, and the monoclonal antibody costs a couple of grand per dose. Molnupiravir, which is the new drug that's being studied, I think likely to be the first oral antiviral that will come out. And that's going to really, I hope, change the landscape, because we'll be able to give a convenient, relatively cheaper therapy that will do a very good job against preventing 50% or so, preventing more serious infection. And then finally, one of the new, it's an old antidepressant that was studied, even as we found no data for the antiparasitic agent and the anti-malaria agent, hydroxychloroquine, and the like. This antidepressant, it's an old, really not very much used drug anymore, showed pretty good data in some of the trials that have been looking at that. And so that's going into larger studies that continue to look better. So that may also gain some approval for that use. So we do have some antiviral things both out and on the horizon, but that's kind of a quick summary of how we treat people. And I would point out, since you mentioned steroids, don't take steroids early in infection before you need oxygen and a hospitalization. People tended to do worse when getting that. And so, please don't take any steroids unless your oxygen drops, because otherwise you're suppressing that immune system that you want to get ahead of the virus, at least at first. I have one other question from the, and this is the hardest question and response I've ever gotten from the feed in over a year and a half now. And this, I think, really addresses the pain of this illness. And it says basically, this is a lady named Betty says that my husband was in the hospital for months and was ill for months, died of COVID. Why was his family unable to see him at the end? Who's going to take care of my only child grandson? And the rest of us were all fully vaccinated. Why is this happening? People dying alone. And I read that, and I don't have an answer to that. I wish I did, but I think it is her pain is echoed in so many people. What we've been through in having to literally at first just essentially watch people die because we had nothing to offer them other than just supportive care and weren't able to do anything specific against the virus. But even after that, we had not as good of understanding of the disease, and there were very heavy quarantine protocols, and many people, including some friends of mine, one of my ministers, and I was there for some of those people when they died. I mean, I was there and watched it, and it's been very heartbreaking to see people live the end of their lives without family there. And that to me is one of the hardest things that we have faced. And I can say it, but it's really the nurses that have taken the brunt of that. I've said many times, they had to adopt the role, in addition of healthcare giver and nurse, they had to adopt the role of family. And they tried to be family for those patients. They would do FaceTimes with families to the extent that they could. But I think it's just emblematic of the pain that we've seen. And again, you can't compare the pain of a nurse to the pain of the family and the patient going through that. But I've said many times that many of my nurse friends are my newest and largest heroes because they've been through that time and time again, and the pieces that's taken out of them. And so this question really, I think, hit home as to the pain that we've all felt. Thankfully, we know more about this situation now. We typically are able to get people to visit at the end of life. For family members now, we actually have gear that people can wear to be safe in the room, in the facility, to be able to make a visit like that makes all the difference. But the fact that we went so long without understanding and being able to do that is something that you can feel the pain in that message. And I can assure you that I saw a lot of doctors and nurses praying over patients and for families through all this. But it's something that sticks with all of us, that's for sure. But thanks for that response, as painful as it was. Any other questions I can answer? Okay, hope everybody has a great weekend.